Health workers in Nigeria are calling on the government to ensure internally displaced persons get access to quality health care and COVID-19 vaccines. As Turaya Farouk reports, this comes as part of events to commemorate the 2021 World Humanitarian Day.
The World Humanitarian Day celebrates frontline workers who are risking their lives to provide humanitarian services to those in emergency situations around the world. It is also a day to remember health workers who have died in the course of providing services. The umbrella of Public Service International and its affiliates, the National Association of Nigerian Nurses and Midwives, as well as the Medical and Health Workers Union, provide incentives such as food, medication, and treatment for some internally displaced persons.
They come to recognize us that they are still there with us, and they bring drugs for us, they bring food, grow food for the women, they treat our children, and they give us food to eat.
Officials say their focus this year is on access to provide vaccines to vulnerable groups across the country.
Our focus even this year is to focus on access to COVID-19 vaccine for the vulnerables, people in IDP camps, refugees, and even migrants in Nigeria. Because, without protection for everybody, there is protection for nobody.
The workers want the government to support the call on the World Trade Organization to waive copyright laws on COVID-19 vaccines to help developing countries that have the capacity to produce them.
So we are calling on other African countries to join South Africa and India that are really at the forefront in calling for the waivers so that at least other countries can also be allowed to produce this vaccine if they have the capacity. Because so far, in the entire continent of Africa, we have not even vaccinated up to 17%, when other countries in the rich world, part of the world, have done even more than 80%.
The nurses also appeal to the government to provide security for healthcare workers, especially in the north.
We have had cases of abduction of nurses in their health facilities, and it has even come to a stage that in some states it's difficult to advise nurses, especially, and midwives to go to hospital in night shift in uniform, because bandits, all these insurgents, are looking for healthcare workers to abduct. So it's a serious thing, and we are asking government to look into it and provide more security around healthcare facilities to secure the healthcare providers.
The healthcare groups hope to honor all aid and health workers who continue, despite the odds, to provide life-saving support and protection to people most in need. Turaya Farouk, Arise News.